Hey everyone. Welcome back to the channel. Today, we're diving into a topic that could literally save your life. How often do you experience a random ache, strange symptom, or persistent discomfort and just brush it off, thinking, it's probably nothing? Well, sometimes, those little signs are your body's way of waving a red flag, saying, hey, something's wrong. In this video, we'll uncover 10 common health symptoms you should never ignore. These aren't just minor inconveniences, they could be indicators of something much more serious. So, grab a seat and stick around because this might be one of the most important videos you watch all year. Let's get started. The first symptom to watch for is chest pain or discomfort. Many people associate chest pain with a heart attack, and while that's certainly a possibility, it could also indicate other issues like angina, pulmonary embolism, or even a stomach condition like acid reflux. The key here is persistence. If you feel sharp, crushing, or squeezing pain in your chest, especially if it radiates to your arm, back, or jaw, don't delay. Seek medical attention immediately. Next, let's talk about unexplained weight loss. Sure, losing weight without trying might sound like a dream come true, but it's a major red flag if you're dropping pounds rapidly without changing your diet or exercise routine. Unexplained weight loss can be linked to serious conditions like cancer, diabetes, hyperthyroidism, or chronic infections. If you lose more than 5% of your body weight within 6 months and can't pinpoint a reason, it's time to consult a doctor. Another symptom you shouldn't overlook is persistent fatigue. We all feel tired sometimes, but if you're constantly exhausted even after a good night's sleep, it could point to an underlying issue. Fatigue is a common sign of conditions like anemia, thyroid problems, sleep apnea, or even mental health concerns like depression. Pay attention to your energy levels and get checked out if fatigue becomes a regular part of your life. What about sudden, severe headaches? If you're hit with the worst headache of your life, don't just pop a painkiller and move on. It could be a sign of a brain aneurysm, stroke, or meningitis. Even if it's not life-threatening, recurring headaches could signal migraines, high blood pressure, or stress-related tension. When in doubt, see a healthcare professional. Moving on to the next symptom, shortness of breath. Sure, it's normal to feel winded after intense physical activity, but struggling to breathe during everyday tasks or while at rest is a different story. It could indicate asthma, chronic obstructive pulmonary disease, COPD, or even a heart condition. In rare cases, sudden shortness of breath could point to a blood clot in the lungs, which is a medical emergency. Let's discuss persistent or high fever. A fever is your body's way of fighting off infection, but if it lasts for more than 3 days or spikes above 103 degrees Fahrenheit 39.4 degrees Celsius, you should take it seriously. Prolonged fevers can be a sign of serious infections like pneumonia, tuberculosis, or even conditions like lymphoma or leukemia. Now, here's one that's often ignored, changes in bowel or bladder habits. This includes constipation, diarrhea, blood in your stool or urine, or a sudden increase in urination frequency. These changes could signal anything from urinary tract infections to irritable bowel syndrome or even colon or bladder cancer. Don't let embarrassment keep you from getting help. Another symptom to watch out for is numbness or tingling in your hands or feet. While this could be as simple as sitting in one position for too long, persistent numbness may indicate nerve damage, multiple sclerosis, or diabetes. It's important to address this symptom early, especially if it's accompanied by weakness or difficulty moving. Let's not forget persistent cough or hoarseness. A cough that lasts more than 3 weeks, especially if it's accompanied by blood, could point to lung conditions like bronchitis, asthma, or even lung cancer. Similarly, chronic hoarseness might indicate issues with your vocal cords, acid reflux, or thyroid problems. Finally, let's talk about unexplained pain or swelling. Whether it's a sore joint, a swollen limb, or persistent abdominal pain, don't ignore discomfort that doesn't go away. Pain and swelling could be a sign of infection, injury, or even deep vein thrombosis, which can lead to serious complications if untreated. So, what should you do if you notice any of these symptoms? First and foremost, listen to your body. It's better to be overly cautious than to ignore something potentially life-threatening. Schedule a visit with your doctor and provide them with as much detail as possible about your symptoms, when they started, how severe they are, and whether they're getting worse over time. Thanks for sticking with me through this important video. If you found this helpful, make sure to like, subscribe, and share it with your friends and family. Let's keep the conversation going. Stay healthy, stay safe, and I'll see you in the next video.